Chronic kidney disease is the gradual and irreversible loss of kidney function. It happens when there's a change in structure or function of the kidneys. 1 in 3 American adults is currently at risk for developing kidney disease. However, to understand chronic kidney disease, it's important to understand exactly what the kidneys do in our body. They balance the levels of fluids and salts in the body. They produce hormones, and they also filter harmful waste products from the blood, and they excrete them as urine. Chronic kidney disease can result from injury, inflammation, pregnancy, dehydration, blood pressure problems, or genetic issues. This all results in a decrease in GFR. It results in diluted urine production, increased bun, electrolytes, and acid-base imbalances. There are a few ways to treat chronic kidney disease, and there's medication, which we will discuss later. There's kidney transplants, which there's hundreds of people on the waiting list and can be difficult to achieve. And then there's 2 forms of dialysis. The first form of dialysis that will be explained in depth is hemodialysis.
Hemodialysis is one kind of dialysis which usually is performed in a center. And hemo means blood, so it's blood dialysis. A small amount of your blood is taken out of your body at one time and put through a filter and cleaned and put back in. And that's done over and over a period of 3 to 4 hours, usually 3 times a week.
The second type of dialysis is peritoneal dialysis.
PD uses your peritoneal membrane, the lining of your abdomen, as a filter. For this kind of dialysis, a tube called a catheter is surgically placed through the wall of your abdomen. This site is near the navel. About 3 to 4 inches of the catheter extends out of the body. This catheter is a permanent access for PD. During treatment, a special solution flows through the catheter into your peritoneal cavity. While the solution remains in your peritoneal cavity, waste products and excess fluid pass from the blood through the peritoneal membrane into the dialysis solution. Your peritoneal membrane acts as the filtering device, similar to the dialyzer in hemodialysis or to your own kidneys. After a certain number of hours, the solution is drained through the catheter and out of the peritoneal cavity. The used solution, which contains waste and excess fluid, is then replaced with fresh solution.
A person living with chronic kidney disease experiences a lot of emotional and physiological changes. As the disease progresses, more toxins build up in the blood, and the patients develop high blood pressure, nausea, vomiting, lethargy, and tiredness. And dialysis is often done 3 times a week for about 3 to 4 hours for patients on end stage of the disease, which leaves the patients feeling very tired. It's time-consuming and it's exhausting. Some patients are unable to keep up with working full-time, which affect them financially. Patients also experience difficulties concentrating and insomnia. There's edema in the legs, there's a lack of appetite, really bad itching that's persistent, shortness of breath. It's important for patients to add an exercise regimen and to be on renal diets such as less protein, less sodium, and phosphorus, because eating food not good for the kidneys makes it harder to facilitate the breakdown and can eventually lead to death. In our case study, we learned a lot about Maria. It's easier to understand chronic kidney disease when you look at just a narrative from her life. It'll help you better understand the signs and symptoms and what it truly means to have chronic kidney disease. You'll be able to see just a glimpse of what she has to deal with.
Unfortunately, a week ago, last Thursday, I was admitted into eMERGE with chronic abdominal pain and nausea. Was also experiencing critically high blood pressure. For those of you who know numbers, I guess, in blood pressure, I had 238 over 180 on average, and normal blood pressure is about 135 over 65. So, I was at the brink of an aneurysm, a heart attack, or seizuring, and unfortunately, one of the above was the experience I had. I began to seizure Friday, night, so 24 hours after being admitted into Emerge, and coded, which means I stopped breathing fully. I went into full shock and had a total of 5 seizures in a row, to the point where the only way to stop the seizures was inducing a coma. I was placed into full coma and unsure of where I stood. For over 24 hours I was in a coma, and I was very lucky to come out of it. And the fear, I guess, I don't remember any of it, thank goodness, in a way. It's like your body protects you of these things, but the fear that my parents went through was horrific, and to say the least, my life has done a 360. I just got in from the hospital yesterday night, and I have lots of muscle atrophy. I'm covered in bruises from both the seizures and the lack of veins. And I'm starting a brand new regimen of tons of drug therapy for my seizures and tons of drug therapy for my high blood pressure.
Maria goes on to wind up getting off of dialysis a year later. It's important to just monitor your lab values and to change your diet, but you should still continue living a healthy life and experiencing school, work, family, and friends, and doing everything that you wanted to. Thank you.